said, been here for about a month, but I'm so happy to be here today and to hear from all of you. I'm really looking forward to taking this information back to the commissioner and figuring out ways that we might be able to help move this work forward. We very much care about victims and their rights, and domestic violence is an issue that is near and dear to our hearts. So happy to be here today. Thank you.
So in the interest of time, because we have a lot of speakers today, we're going to jump right to it, but I'm going to give you a little bit of background about who OPTV is. So the Office for the Prevention of Domestic Violence is the only office of its type in the country that really speaks to New York's values around the issue of domestic and gender-based violence. Our job is to work with our state agency partners as well as the community to really figure out how we address the issue of domestic, sexual, and gender-based violence in the state of New York. Part of our job is to listen to the folks who do the work every day in the field and take that back and make policy and make good policy. Over the past couple of years, we've really doubled down on that work and engaging the communities. We have domestic violence regional councils. We have survivor listening sessions, so we're making sure that the survivor's voice is also represented in the policy and programs that New York is thinking about. We do know that a lot of the systems that are in place were put in place 30 years ago. And it's our job to rethink, all of us up here as well as you, to rethink how do we address what's going on in today's world around gender-based violence. So we're here to listen to you about that as we head into our policy time and our budget times and the recommendations that we make as agency policymakers up the chain, both to the legislature and specifically to the governor. So that's what we're hoping to hear from you today, are your thoughts about how we can improve the system. Don't be shy. Tell us what you really think. Except for Nicole, she can't tell us what she really thinks. I always pick on her when she's in the audience because she's very funny and she give it back to me. And our subject matter is really heavy. So I also want to say to folks, if you need to take a minute, we'll understand. Just take care of yourself with these stuff because it does get pretty heavy. So we're going to start right away, and we're going to call Ms. No,
she's not here, Kristen.
Kristen, you're up first.
Here we go. Good afternoon. My name is Kristen Balo, and I am from Binghamton, New York. Broome County, located in the southern tier of New York State, has had a Family Violence Prevention Council by executive order since 1985. As coordinator for that council, I have found that the collaborative work we are doing is not the standard across the state, but the exception. On the daily, I work with victim service agencies, child protective services, law enforcement, attorneys, substance abuse counselors, and educators to identify and reduce incidents and severity of child abuse, elder abuse, and domestic violence in our community. In 2021, my community began discussing a domestic violence fatality review team to address combating and responding to domestic violence in our community. When we hit our first barrier, we reached out to Westchester County and were asked, why are you waiting for someone to die to talk about their case? And with that, everything changed. And our team quickly regrouped and focused on becoming a coordinated community response. The purpose of this proposal will showcase the necessity for New York State to mandate and fund a coordinated community response system throughout New York State to increase victim safety, offender accountability, education, and collaboration, alongside a lethality assessment program to identify high-risk victims. Broome County's current CCR is known as our Domestic Violence High-Risk Team. It is a function of the Family Violence Prevention Council, and our team is committed to it being a county-led initiative for several reasons. A centralized county response provides coordination across geographic boundaries and jurisdictions, offers transparency in funding and resource allocation, there's collaboration and cross-sector conversations, and builds long-term commitment to the community. The county's unbiased nature is essential to the relationship and trust that must be present within our team. Our team has 4 major components. Our lethality assessment program, known as LAP, case review of high training all of their officers to utilize the lethality assessment screen to identify high-risk victims and then connect those victims with advocacy on the scene. Since January 2nd, 2024, our LAP program has identified 54 high-risk victims in our community and connected them all to advocacy at our local victim serving agency, Crime Victims Assistance Center. When we identify victims through our LAP, we obtain consent to discuss them in a confidential, multidisciplinary case review. Not only have we witnessed victims assessing and agreeing to safety, services, and long-term assistance, but we have seen an increase in communication between law enforcement, service providers, child protective services, and other services like housing and mental health. We are currently tracking how many victims are identifying independent housing as a barrier to seeking safety. We are also working with child protective services to ensure victims are treated as such and not held responsible for the actions of their offenders. This case review is also tracking the offender's criminal charges and journey through the criminal justice system, ensuring they are being held accountable for their actions. We utilize information through our service providers, district attorney's office, and integrated domestic violence court to track charges and outcomes. All these components feed into our educational needs. These are topics, concerns, and misunderstandings that need to be focused on to ensure all of our community partners and community residents have sound understanding of the complex and sensitive nature of domestic abuse. We believe when we have an educated community, we have an educated juror. This work has been accomplished on top of our regularly scheduled job duties. If funding a CCR coordinator and financially supplementing the work we are doing, our reach could be astronomical. Our lethality assessment could grow to include all 8 law enforcement agencies. Currently, we have buy-in from our New York State Police, but we cannot grow beyond that as the advocates and the clinicians do not have the manpower to address all the victims that we would identify. Trying to hurry up the slide. A coordinator would also be able to facilitate an increasing number of children who can be interviewed at the Child Advocacy Center for victims of domestic violence and or witnessing violence on child protective investigations. Our local CAC is often underutilized due to complex scheduling that interviews require versus the high caseloads of caseworkers working to get involved and interview children to assess safety. Many CACs utilize weekly case review to increase the stability of clients, and this is best practice. With a dedicated coordinator and more staff dedicated to victims, the case review process would be able to meet weekly, allowing for professionals invested in each of these cases to receive information quickly to progress towards safety. Much of this work has been possible in Broome County because of our Family Violence Prevention Council. In this role, I can identify needs and build systems that support our mission of reducing domestic violence. However, my role does not exist in every county, and my abilities are limited. This problem does occur in every county, though. By mandating and funding a CCR coordinator and other components of response for each county, all of New York State could begin to identify the strengths and opportunities needed to achieve collaborative and comprehensive safety and justice for victims and their families.
Thank you. Don't go anywhere. Anybody got questions?
How much money?
All the money.
He's very blunt.
Not independently though. How much was the startup from the Broome County Sheriff to kind of get this off the ground? Or did they just fund the lethality assessment piece?
So, we had a grant from a local nonprofit that funded the advocacy. I believe it was $30,000 for the year, and that funded on-call workers, and it funded some of one clinician's salary to follow up with those victims identified as high risk the following day.
Awesome. What do you think is the biggest, outside of funding, are there any jurisdictional or information sharing barriers to the program that you've run into over the last few months?
Not in this program, no. When we were discussing fatality reviews, we came up against some confidentiality and things like that, which the state has the luxury of kind of writing into their programming. But we have not. We found that officers, law enforcement agencies are ready to go. It's really the lack of resources and response on the victim serving end that is preventing us from doing that outreach and collaboration.
And how's training gone on the lethality assessments?
It's amazing. The officers are so tuned in. We partnered with Westchester. We had a survivor come and share her story. Since we've identified our own survivor that we work with on the daily to ensure this work is done in a survivor-focused manner. But they were so receptive. They routinely told us it was the best training they'd been to. They could have done it longer. They love, we've had multiple ongoing conversations with them, but they absolutely love that they don't leave a scene feeling like they could have done more. They love the connection that they build with the advocates on the other end of the phone. They love the results, and they're starting to see a decrease in response to some of the households.
That's great. Clark's gonna kick me if I keep going, but thank you very, very much.
You don't kick here. You're not me. We do a little routine, just so everybody changes that. Okay. So, who is it that you work for?
I work for Broome County Government,
Okay, and the advocate works for who?
Crime Victims Assistance.
And so the confidential advocate.
Correct.
Thank you so much, it was great.
Thank you, Kristen.
Who we got next, Clark?
Alex. Alexander.
Okay. Why don't you just call them out? So
Sure.
we know who's here.
I'm ready.
Hi, good afternoon. My name is Alex Mikowski. I'm the Executive Director for Access to Independence, which is a local independent living center focused in Portland County. We're one of many centers across the state and across the nation. I myself am a person with multiple disabilities. One of those is a speech disorder, so you might hear me stutter some. First, I want to thank you for the opportunity to speak. Also, thank you to OPDV for your accessibility work that you've really been working on. And I haven't really, from my perspective, and there might be things going on in the other state agencies, I haven't really seen that effort that OPDV is doing. We know that rates of domestic violence are way too high for any single human, but people with disabilities are at a higher rate than people with developmental disabilities are at a shocking rate. And then if you identify the person as, yes, they've gone through something horrible, many of the programs aren't accessible. Either physically, they don't have language accommodations, you can't go to a safe dwelling if you need an aid, because then the person is going to violate on confidentiality and there's another human wandering around. So then people are systematically taken out of the supports that you guys work so hard to build. So three kind of ideas, ranging from very inexpensive, nothing, maybe 2 minutes of Googling, to more hands-on. So each local site that you guys certify, if you guys could know who are the disability serving agencies in your area. Sometimes we don't hear about it until later when somebody says, oh, we needed a wheelchair and I didn't know where to borrow one, or I needed this, or I needed access to that. So just having them know who the people are. Perhaps there could be a suggestion that once a year, you guys meet between the victim serving side and the disability side, just to see if there's any new programs or anything that either you guys are doing or our side is doing. Try to do better with the ADA. I know it can feel like it's a lot. The ADA, or Americans with Disabilities Act, was designed to be a ceiling and not a floor. So thinking about your printed materials, thinking about large print, thinking about Braille or CART or things like that. Because if we don't give education to people in a way they can actually learn it, then we're just setting up people for failure. And especially people that are in a segregated classroom, they often don't get the kind of built-in material that the students get. My thing that might cost money is a site assessment. So maybe every 3 years, you work with someone who understands disability and can just do a little tour of the certified site and give some suggestions. This is something that independent centers, that independent living centers do as a part of our state contract with Access VR. And if there was a small amount of compensation, then there'd be a lot more assessments done. So thank you for your time and for caring about people with disabilities. Thank you so much. Questions?
So I was just curious, because you referenced you didn't have much interfacing with OCFS, to know what
question. So I was a DSS caseworker for many years, foster care prevent, CPS, and in the mental health system as a case manager. So OCFS, especially on the residential side, really tries to support the kid, whatever needs that they have. Some of the bigger challenges are transitioning out. And for those kids that are on SSI, when they transition to adulthood, they have to reapply and there's a process. And oftentimes the family's kind of like, here, there's papers that are given to them by somebody that's supposed to help them, and there's not really someone who understands how the process works or the timelines. So working with certified benefits specialists that are at many agencies, but also often ILCs have them, would be helpful. So we don't see that drop off where they used to get support, now they have nothing, and then they end up on their family's couch, and then more likely to be a victim because they have less social supports and connections.
Great, thank you.
So when you said a site assessment, are you talking about the shelter and non-residential services, DV services providers? Is that the site assessment you're talking about?
Yeah, so it could be whatever you guys frame it as, but we work with people that are more office-based to look at their documents they're producing, to give accessibility suggestions there, or internet, sites or presentations. So it really could be whatever you guys want to do, but that's things that we have experience with across the gamut, from the person who's developing, the Canva flyer to the, safe dwelling.
Thanks, and thank you for being here. I don't want to be rude to Google, but what would be the best place to go for the resource guide? Like, is it to go to the ILCs? You talked about providing a resource guide to our programs to make sure that they know how to know the landscape of disability access resources. Is there like a one-stop shop, or are there really good county programs that we should look at?
Yeah, that's a great, question. NILE, which is Independent Living Center, so it's our state association, has a lot of great tips. So we're doing something similar with local libraries right now, that across the state, it's like $100 a library to pay for staff time for us to go in. It doesn't cost the library anything. It's a short-term project, but you can kind of get a baseline of what's happening, so that you know, well, how many people don't have X or Y.
That's great. Thank you so much.
Thank you.
Stephanie?
Sorry about that. Accessibility.
Hi, good afternoon. Hi, I'm Stephanie Saunders. I'm coming from Community Services for Everyone in Buffalo, New York. I'm the director of our domestic violence programs there. And that was actually a fantastic person to follow, because I'm here to propose and talk a little bit about how do we better support those with disabilities at the intersection of domestic violence and sexual assault. So in 2016, Community Services for Everyone established a partnership with the Family Justice Center of Erie County to create a project called Hope of Western New York. And the mission of this is to improve access to domestic violence services and prevention education for people with intellectual and developmental disabilities, to ensure those experiences are identified and linked to the resources that will help them lead their journey toward healing. Hope of Western New York provides outreach, advocacy, and prevention education services for people with disabilities, so they can be better aware of what does a healthy relationship look like? What might be some red flags? Could this be something they're experiencing, or just be better aware of? We also provide training to other community-based organizations on the intersection of domestic violence and disabilities, and we did this in partnership with Niagara University and the Institute on Disability Awareness. We want service providers to be better aware of the challenges that victims or survivors with disabilities face, not only in those instances being victims themselves, but also the challenges they face on their path to survivorship. We want to acknowledge that it is hard enough for anyone gain that, give that understanding to our domestic violence and sexual assault workforce. She talked about accessibility. We often think of accessibility through the physical spaces, the written materials, our websites, but we also want to think about the accessibility of the service providers themselves, the awareness they have on the additional challenges, the characteristics related to someone's disability that may impact their experience in being able to access those services. So the proposal that I'm putting forth is that the training that Hope of Western New York currently provides be something that is considered for standardized and required training for all domestic violence and sexual assault service providers and advocates. So that way we can have that workforce prepared to provide accessible, compassionate support.
Thank you.
So in terms of bringing it to scale, what do you think is the biggest, again, other than cost, what's the biggest barrier in terms of the model? Is it just straight training? Is it the informational piece of it, or partnerships with other community-based organizations? What's the secret sauce?
Great question. Ultimately, what we want to see is creating that greater sense of awareness. Even though the ADA was 34 years ago, people don't necessarily take that seriously. Accessibility is not new, and it shouldn't be optional anymore. And so many places do feel that way. So getting that under the required training for anybody who is serving people with disabilities, whether they know it or not, because we know that some disabilities may not be visible. So creating that awareness so that people are fully prepared and accessible as service providers and not just their physical space.
Thank you so much.
Thank you.
Hi, everybody. Good afternoon. Thank you so much for hosting the space. Thank you so much for inviting us to talk. My name is Tiara Labrada. I'm the Associate Director of Advocacy and Supportive Housing Network of New York. We are a nonprofit membership-based organization representing the other nonprofits that develop and operate supportive housing. And I'll give you a quick primer on supportive housing for those of you who may be unfamiliar. Supportive housing is permanent affordable housing with wraparound support services that provide housing services to people who are fleeing or attempting to flee domestic violence, veterans, youth, aging out of foster care, people with a diagnosed mental health condition, substance dependency, and who have a history of homelessness. Another quick primer on supportive housing. We call it the three-legged stool in order for it to maintain. So you need the capital to develop the building. You need the rental assistance or the operating subsidy to be able to maintain the building and make sure that you can do renovations and upgrades and pay your utilities. And then you also need the service funding, which provides the case management services to the residents who are living in supportive housing. Collectively, our members operate about 62,000 units of supportive housing throughout the state. We have about 200 members who are operating supportive housing. I'm going to read now from my testimony. We commend Governor Hochul for recognizing the need for more affordable housing for services through her renewed commitment to the Empire State Supportive Housing Initiative, which is the state's commitment to develop 20,000 units of supportive housing over 15 years. It's the newest, shiniest supportive housing development program in the state right now. Funded at about $25,000 per unit, and that's going to be important in a minute. But today we want to focus on challenges faced by our members who operate the first generation of supportive housing. The New York State Supportive Housing Program, also known as NYSHIP, was established in 1987 and introduced a pioneering approach to helping people at risk of and experiencing homelessness and other related challenges like I just mentioned. By funding services within housing, NYSHIP connected tenants with essential community-based resources, like all of the wonderful people here who are providing resources to people with disabilities and people who are experiencing domestic violence. These early supportive housing interventions demonstrated success as a cost-effective solution to homelessness and a model for preserving existing affordable housing stock. As a result, New York State developed a succession of new and better funded supportive housing programs to more comprehensively meet tenants' needs, paying for both services and rental assistance and operating costs. Again, that three-legged stool. By 2002, the state and legislature expanded this program to serve families and young adults, many of whom had experienced domestic violence. That the Empire State Supportive Housing Program has survived domestic violence as a priority population for development. programs do not have rental assistance and rely on either shelter subsidy or tenant contribution, and sometimes as low as $300 a month. So if you have a building, you don't have a lot of operating subsidy, you have really low service rates, you're not able to maintain the building as such, right? You're not able to make renovations, you're not able to make upgrades. And a lot of our programs are really experiencing crumbling infrastructure at the moment, which does not allow people who are living there to live with dignity. Much of this housing, which was built in New York City resources, is 30 years old. And this is unsustainable, as evidenced by a loss of 20% of our national programs since 2006, a lot of which serve families and survivors of domestic violence. So what are we asking for? We are asking for money, and I do have a dollar amount. We are yes,
It's always good to have a target.
I have a target. 1 minute. Okay. We are asking for a supportive housing preservation program, which will essentially bring up 9,000 night shift units that are really in danger of becoming extinct. We're asking to bring those up to ESHI units. That's $25,000 per year, and that's for rent and services. This would also help unlock some preservation capital that HDR currently has, which our members are not actually able to get because they don't have the operating funding to be able to take out capital. It gets a little wonky, but they can't unlock the capital preservation funds without the operating, and they can't do that when they don't have an operating subsidy, and they're really cobbling together a lot of resources to be able to pay for case management services. So that's it. I got other stuff to say, but you have my okay. I have to say questions.
So
I used to work for YWCAs who are among the many of those first groups.
Yes.
Do you know how many of the current ESHI population are, anyway, not? I don't know this off the top of my head, but you know what I mean, are TV dedicated? Yeah,
I don't actually know if there's a target for the ESHI.
Mhm.
So if there's like, we're setting aside 7,500 units for domestic violence, or whether it's, sort of provider specific. But I can get that if there is a target.
Yeah. And, we know that one of the number one issues for a victim of domestic violence is finding stable housing. So, this is really important to us. Is there a way in which you think, because, we've had a number of summits around domestic violence and housing and all of those things, but New York City's really good at doing some of this stuff, but upstate, our providers need some help understanding how to do that. Is that
When you say how to do that, what do you mean?
Well,
How to,
I mean, we have Niagara does
Yeah.
a lot, one of our TV providers that does a lot of housing. I think we're gonna hear from the wife, but not everybody wants to be in the housing business and the AV business. Is there
Right.
something that you can think of that we might be able to do to incentivize that, other than money? Obviously, but.
here I am, I'm talking about permanent supportive housing, right? But there are so many other housing options that we can provide to people who are experiencing domestic violence that don't require a service provider to be in housing. And one of those is called rapid rehousing.
Yeah.
The federal government is really targeting domestic violence and young adults for rapid rehousing, which essentially provides a short-term rental subsidy and then sort of staggered so a staggered rental subsidy that hopefully will get them to a longer-term voucher, like housing choice voucher, EHV, or something like that, or FFS. And then sort of short-term intensive case management that also sort of lays out. So you could be sort of in the housing business and help them connect to housing, connect to independent housing, and then sort of slowly into some community-based resource that will allow them to be more independent. So you don't have to build a building and sort of operate and maintain, because as evidenced by what I'm just here to talk about, it's hard to do when your funding is stagnant, which is what MASHIP has been for the last 30 years.
okay, so it's the connection, the
Yeah.
connection between housing and non-residential services.
Yeah. Vouchers. Universal vouchers.
So, my math might be off, but so you've identified 9,000 that are supported by the whole program.
Yeah.
So the difference being $22,000 in support between 25 and the 2,000 now. So that's 198 million. So is the $32 million that you're asking for, that would support 1,454 of the 9,000?
What's
So-
your name? Joseph. Hey, you're doing math here. Hold on a minute. Wait a second.
Wait, get them a whiteboard.
Yes. I So if you can only do with $32 million, you can do 1,454
Yes.
of the 9,000. How do you prioritize them? What do you think about in terms of?
So it's actually more than 9,000, but what we're doing right now is prioritizing 9,000 at this, I didn't come up with that, okay?
Yeah.
And essentially what we,
I thought it was a great deal. I was like, 32 million. I was like, that's great. And then,
so we're actually, there's more than that. So there are 20,000 households that are being served through night shift right now, 9,000 of which are getting services only, which means they don't have a rental assistance subsidy, which means they have to cobble together other resources in order to operate their buildings, which is why their infrastructure is crumbling, right? So we need to make them more accessible. We don't have push doors, the bathrooms are small, the elevators are not working, right? And it does not allow for people to age in place, live in dignity. So the $32 million is for those 9, and then there's a 5-year phase-in plan, but honestly, I focus on New York City policy, and I'm here as a
Well, welcome to upstate New York.
I actually live in Ithaca.
Okay, all right,
But
good.
my colleague, Steve Kaiseki, who a lot of you may know, he's our state policy manager, and the next year is his campaign. So I can get you all of that information, but I do know it's a 5-year phase-in approach with $32 million as our initial ask for the 9,000 units that our support services company.
thank you. That's very helpful.
Okay. Thank you.
Oh, B, come on in, B. Come on down. It's a very special birthday. I know, they're waiting for a break.
I'm gonna hop with my Nancy preteen, so thank you so much.
Of course, thank you.
Hi, everybody. Glad to be here. I'm Dee Hansen. I'm the new director at the State Office of Victim Services. I've been there for under 100 days. So I've stopped counting the total days, but I'm around under 100. So, and coming from, so I was, before this, I was at the Mayor's Office to End Domestic and Gender-Based Violence in the City of New York. And before that, I was at the Office of Violence Against Women in the Department of Justice. And super happy to be here. Sorry for my delay. I didn't take into account all the road work that was happening across I-90 on my way over. So my 20 minutes early is 20 minutes, is half hour late. So sorry to hear, I missed the first couple of people, but I know I probably will get you up to speed. So as usual.
Yeah, Little Falls was rough.
I couldn't ask to follow a better segue into what I'm going to talk about. So, my name is Teresa Bouvier, I'm the COO of YWCA, I've been there just about 20 years. Yeah, Kelly, way back, right?
Way back.
Way back, before you were so YWCA. So my 2 ideas of proposing a change for New York State OPDB would be, they kind of flow together. It's the homeless housing and the economic empowerment, which goes into what Kristen's already talked about, and I was just gonna brag about Broome County. It's that integration of services, and this came in a perfect timing as well, because I was in a meeting yesterday that I would just kind of like pull it all together instead of going over exactly what I had written down. But since we've known you, Callie, like we now have like really just gone into housing. It just really was something we do well, and it, you know, kind of I'm always like in shock that we do it really well. We had 12-bed homeless shelter for women years ago, like 15, 20 years ago. Now we're at 84 beds a night in the city of Binghamton. And it's only for adult women. Sadly, there's not enough funding with DSS. And again, we love our Broome County DSS. There's no complaints of our service providers there. It just doesn't go. In New York State licensing for shelters, they have this ratio humans to toilets, right? So there's no big building in the city of Binghamton that would have those like that amount of ratio. We have this beautiful building now that we have 61 homeless women, and at 80 Hawley Street is kind of our flagship. That has our elevator, so when we're talking about having it 88 compliant, we had this kind of thing like we can do 61 at 76, anyone with any assistive devices or issues with physical disabilities, they go to 80 Hawley where we have a working elevator. In addition to that, we've really expanded our rapid rehousing and permanent supportive housing. We are hopefully one of those. We have 48 night shift units. I hope we're in the 9,000 priority, but
we have learned how to layer some HUD funding for our DV survivors. So I kind of want to make that clear. We are not victim service providers as fleeing DV. We do the permanent DV survivor. We can still use HMIS. That's like the big difference, right? So the meeting yesterday, as we talked about, there's this gap. So let's just say in any town, I'm not going to pretend I'm not from Broome County, in any town, from what I hear on these phone meetings, DV victim service providers that run shelters have 3 cardinal rules. And one is don't disclose where we are at. I forget the other 2 because we always pick up the rule that's broken. They told us they're abuser, excuse me. 1 minute, okay. So anyway, in all that, we're asking New York State to consider more money for shelters. We have a big HI that we're opening up for DV survivors. And then the second piece, I'm gonna jump to my economic empowerment, very specific. I want some kind of incentive from New York State to work with big employers like Amazon, Dick's Sporting Goods. We have really large corporations now. I want them to believe that we can get our ladies to work in high-paying jobs. So I'll end there because I think I've used up my time bragging about Broome County. I tried to just give you very specific incentives and shelter.
So, I just have a question, and you might not know the answer. So, the governor has put into her, as part of her budget the past 2 years, and will be continuing funding, flexible funding for domestic violence victims. I know you aren't a DV provider, but I'm assuming, and if you're not, you're working with the folks who get that money to help with any needs, financial needs that may come up that don't fit into other funding buckets. And if you're
It
not,
doesn't go 2 ways, right? So if you get, I think they always call it like VAWA funding or victim funding, right? They don't come to us for services other than if they're discharging someone. So when we at the YWCA have, say, 20 women that have been sanctioned and, you know what I'm saying? Like,
yeah, but this funding should help that,
okay.
because it's state funding and it doesn't have the,
Okay, I'm not aware of that.
yeah, so we'll make sure that we
That
talk
we
about
take
that.
care of that, yeah.
No.
Thank you.
Okay.
Thank you. Maureen.
Good afternoon. My name is Maureen Grizzolini. I'm the Deputy Chief Clerk of Portland Supreme County Courts. I've worked in the court since 2018, starting as the Integrated Domestic Violence Court Resource Coordinator. Now as Deputy Chief Clerk, I oversee the current IDV coordinator in all the court functions. I can attest that our IDV court is one of the best in our district and one of the most modeled after in other counties. We have an incredibly strong team that works together to find solutions to break the cycle of domestic violence. Our recidivism rate is low. About 80% of the offenders that come through our courts and after completing an IPV batteries program, we never see them again. Our city police is adapting the lethality assessment. They've rewritten their domestic violence policies and how they respond to calls. I'm proud of the work we do, the victims we have helped, and our success. I provided a list of points to you all that aren't working so well or could be changed from our stakeholders' view. And as important as that is, there's one point I personally wrote down, and the more I thought about it, the more I wanted to emphasize that today. Point being supervised visitation for domestic violence cases that come through our court under Article 6 petitions. Last year, I was fortunate enough to be a part of a work group through the Office of Court Administration looking at what supervised visitation looks like for domestic violence survivors in New York State where there are Article 6 cases and domestic violence present in those petitions. Over the years, family court, IDV courts, and matrimonial courts in New York State have experienced an ongoing dangerous lack of resources for families in need of safe, supervised visitation and safe exchange programs that are sustainable and available to families in crisis. Currently in New York, only 20 counties do not have any supervised visitation programs for custody matters that involve issues of domestic violence, addiction, and or mental health diagnosis. The lack of these resources for families is a statewide crisis, leaving children and families unprotected, unsafe, and at risk of suffering further trauma.
After separating from their partners, as many as 60% of domestic violence survivors experience ongoing threats, stalking, and abuse during visits and exchanging and involve children in common. At least 75% of children whose mothers are abused by an intimate partner have witnessed the abuse, either physical abuse, psychological, or emotional abuse. In 2022 alone, there were almost 16,000 family offense petitions filed or pending that also had a pending custody petition concerning the same parties. In 2023, throughout New York State, there are over 800 families with pending cases in the IDB courts. Based on the allegations of interpersonal violence, most of these IDB cases require supervised visitation. Yet more than 1/3 of the counties where the 42 IDB courts in New York State exist do not have any supervised visitation program. Existing supervised visitation programs were surveyed as part of our work group as to inquire about their ability to accommodate orders for supervised visitation or safe exchanges through Article 6 matters that involve issues of domestic violence. One program responded they could only supervise 20 families in 1 year, based upon their staffing. In counties where there's an existing supervised visitation program, there's often a 6 month to 1 year waiting list. The number of custody petitions or motions to Supreme Court matrimonial cases involving DV of a parent that are filed in the courts reflect that existing supervised visitation programs cannot meet the needs of the families that would greatly benefit from this important service. A few counties in New York State previously had supervised visitation program at one time, funded by startup grants or foundation building. But after the grant funding expired, the programs were not sustainable and closed. Programs reported that the cost of providing supervised visitation services is estimated to be $2,500 to $3,000 per family for up to 6 months of supervised visitation. However, the need for supervised visitation exceeds 6 months, the cost would be greater. The ability to receive consistent and reliable funding would allow supervised visitation programs to offer no-cost visitation and safe exchange to families who require this essential service. Lastly, the need for a safe, accessible, and sustainable supervised visitation and safe exchange program is critical for families dealing with issues of DV, substance abuse, or mental health issues of parents. The lack of these resources for families in need is a statewide crisis, leaving domestic violence survivors and their children unprotected, unsafe, and at risk of suffering further injury and trauma. Without such resources, judges are being pressed to order unsupervised visits or visits supervised by a third party who is not trained in domestic violence dynamics, which places the children in danger. Dedicated funding to implement and sustain these critical resources in every county in New York State is essential for the immediate and long-term safety and well-being of children and families.
Thank you, Maureen. I just want to point out that Maureen is a member of our fatality review team. Your work is very valuable, so thank you so much. I don't have any questions, but agree.
Can I ask you a question that not what you verbally testified, but what you provided? So I wanted your thoughts on the DIR specifically. You know, I think we're undertaking some efforts to look at OPD DCS, looking at the DIR process, you know, how to modernize it, how to update it, how to make it more operational and timely, accurate, and comprehensive. So it's a tool for the courts and a tool for other public safety professionals to act upon. But it looked like you had a lot of thoughts, so I wanted to.
She's also a member, I mentioned, she's a member of the fatality review team. She has a lot of
DIRs
thoughts.
quite a bit in our fatality review team. I know with the DIRs, our probation department should be getting copies of the DIRs once there's a hit on a probationer who violated or got hit on an arrest. They're not getting those copies in a timely manner. It could be months, it could be 6 months before they're getting the DIRs. I know my judge, who is the IDB judge, Supreme Court Justice, she looks at DIRs very, very carefully. I think it was in one of my points that probation pointed out that they can't use DIRs where there hasn't been arrest in PSRs. We all know that DIRs without an arrest still is an indicator of lethality. I think we'd like to see changes surrounding that and being able to access those and provide those to courts and making determinations.
Gotcha. Thank you.
First of all, I agree with you on the supervised visitation, so it's a long-standing issue.
It is.
Let's just see what we can do. I'm early in the stage. I had similar to Joe. I had a question about the trainings on strangulation and some of your thoughts around there. You have it under probation, but it looked kind of like a a larger issue, so just if you talk a little bit about what you see in terms of the needs around strangulation and training.
Strangulation training, we have provided training to law enforcement throughout our community. Our IED court tends to put on trainings. We're seeing a lot of undercharging. So from law enforcement, we're seeing this criminal obstruction of breathing come through as a charge in IED court. After reading accusatory information, reaching out to their district attorney, who works very, very well with our IED court, we've come to the realization that, these victims who are being strangled and the offenders are being charged with misdemeanors, they can't talk the next day. They have physical marks. They have a hoarse voice. That those charges could be elevated to felonies. And I think one of the points on the presentation or on the poll that I gave is elevating those charges, not having a misdemeanor criminal obstruction of breathing. It's strangulation. It should be elevated to a felony. And I have a copy of this report that I can email to you if you'd like.
Sure. We'll
In a blueprint.
We have that report.
I
I
figured you.
Yeah. We'll make sure we share it.
Thank you.
Thank you.
Thank you. Jen.
Good afternoon. Thank you so much for having me. So my name is Jenny Papkin. I work for Restore Sexual Assault Services in Rochester, New York, which is a program of Planned Parenthood of Central and Western New York. And I'd like to briefly talk about Enough is Enough funding and the hope to increase that funding and to expand it. NISCASA, the New York State Coalition Against Sexual Assault, I know in the session in New York City, is going to talk about this on more of a macro level. Their ask, which we support, is to increase funding by $5.1 million to bring the total to 9.6, with $1.5 million in that funding going to a statewide CCRT. But I figured that maybe talking about it on the micro level, talking about the direct service staff on the ground and what we're seeing could help support their proposal. So I oversee Restore's College Advocate Program, which EIE partially funds. Restore serves 5 counties in our service area, Montgomery being the largest. Across those counties, there are 17 colleges and universities with a combined 48,000 students enrolled based on the 2022-2023 academic year. Restore has MOUs with 9 of these campuses and informal partnerships with many more. We only have 4 staff to cover this 5-county region and to support the tens of thousands of students who are enrolled there. These campuses keep us very, very busy. We provide counseling services to students, faculty, and staff. The desire for these services has only grown throughout the years and has been exacerbated by the strain on campus counseling centers from lack of staff and an increase in demand. My staff also provide advocacy services to student survivors, assisting them in navigating medical systems, the criminal justice and court systems, and college systems, including Title IX. Follow students through traumatic forensic rape examinations, reporting to law enforcement, obtaining orders of protection, and help prepare them for grand juries, depositions, and court testimony. Our advocates are with these survivors for every meeting with the Title every statement given to an investigator, and act as advisors through a very adversarial Title IX hearing process where they have had to cross-examine respondents for the last 3 years and are oftentimes across the aisle from very expensive, very experienced defense attorneys, and we provide these services for free, and my advocates are not attorneys. The changes in Title IX regulations over the years have left us scrambling to find affordable trainings to help advise students adequately through this process. Moreover, our advocates also provide the outreach and prevention education on our campuses. Sometimes they do this in collaboration with campus prevention staff. On some of our campuses with more limited resources, they are doing this work solo. Restore staff help educate incoming freshmen on Title IX policies during orientation, teach bystander intervention to a variety of student groups, facilitate discussions on cyber abuse, and train faculty and staff on how to support students and handle disclosures. And I share all of this to paint a picture of what myself and my staff face daily. We are so grateful that EIE helps fund this critical work. An increase in EIE funding would do so much to support and expand what is already being done. With more funding, we could attend more trainings to facilitate evidence-based prevention programs. They would have more time and access to resources to create programs and campaigns that focus on marginalized and high-risk student groups. We could provide more legal support to students who are fighting lawsuits from their perpetrators, which we are seeing happen more and more. We could add more staff to engage more at the campuses we don't have a strong presence on already, and we could fully fund our college advocates through EIE so they can focus 100% of their efforts on students. Right now, our college advocates, 60% of their funding comes from EIE. We cobble together funding from other sources, so being able to fully fund them through EIE would be so, so helpful. And it would also really help in retaining staff. I think probably every agency here would say that like staff retention is the biggest help in providing the best services possible. And when we don't have the adequate funding, like the partnerships that our staff build with our campuses, when there's turnover, they're starting from scratch. And it takes years to grow those partnerships. And when we have good, just person-to-person relationships with our campuses, it goes miles in them working on us to help us support student survivors. Thank you.
Okay, so I have two questions. One is, what have you seen over the last few years in terms of trends of like caseloads that the advocates are, like, what have you seen over, even if it's anecdotally?
Yeah, it'll be. They're definitely increased. I think we've done a really good job since EIE started, and I think New York is great at educating and supporting students who are going through sexual assault, sexual harassment, domestic violence. More students are coming forward, which is a good thing. It's a great thing, but it means our caseloads are increasing, especially with Title IX being so cumbersome. So the investigations can take years. The process is sometimes more intense than like being in a criminal court. And so we've only seen that increase, and we've had funding has been stagnant for the past 10 years. So that's tough.
And then the second one was just, how much do the advocates make? So you said 60% is coming from the EIE. How much is that generally?
Yeah, so our college advocates make about $42,000 a year. And it's tough.
So $21 an hour.
Yeah, so $21 an hour, and they get their master's
With the math.
degrees, and then sometimes they get,
Everyone has to have an hour.
sometimes they go to grad school, they're working with us through grad school, and then they've just incurred $60,000 worth of debt, and they're like, crap, I need to pay my student loans, and then we lose them, and all that experience and knowledge that they've gained.
Thank you so much, I appreciate it. And our names are very similar, so
Yeah,
Hopkins.
Hopkins Happen. Mine's a made-up name from like Ellis Island.
So is mine.
Yeah.
Yeah, I was Popovic, and then I got shot. So.
Wait.
Oh, sorry.
I think you're aware that the University Alliance has done a study about general rape crisis services across the city, and some troubling things have come out of that study that they're bringing to our attention. One of the things that they talk about, and I think it's probably similar, is the sexual assault nurse examiner program and access to those programs across the state and what that looks like and how long it's taking for someone to possibly get a rape exam and or being asked to transport. Sometimes, I think in upstate, 3 to 4 hours. Can you talk a little bit about your experience in regards to that?
It's a public health crisis. I really think it is. We have seen survivors being turned away from emergency rooms because there are no SANE nurses on call. They're told to come back the next day. When you have 96 to 120 hours to collect evidence, that's a really critical, crucial time. And best practice would be to get them in to collect evidence as soon as possible. We're seeing lots of physicians do these exams, and they are not trained on how to do them properly. And thank God we have our advocates in the room that can be like, no, that's not how you store this sample. You need to sign this paperwork. You need to do it that way. And so our advocates, they are critical, but we're not medical professionals, and we shouldn't be guiding medical professionals on how to do these exams. Any of our hospitals would tell you that they have critical shortages of SANE nurses, and so yeah, it's really tough. And we have people that leave and don't come back because they have families, they have jobs, they have kids that they maybe got 4 hours of childcare for, and they don't have that childcare again, and that's a person who's fallen through the cracks. So we're seeing the same exact things.
Trish, did you have anything? Thank you so much. Thanks. Great job.
thank you for hosting this. Obviously, I'm familiar with Kelly, so when I got the invite, I can never say no to Kelly. I'll be
There's
sure.
so many people in this room that have that same, I got a
I'm
call
afraid
from
to say
Kelly.
no. So I'm looking for three things. I apologize. My plan was to have copies for everyone. But ironically, our agency has been tied up with a tragic case the past 2 days. This morning I announced the arrest of an individual who strangled his girlfriend, who happened to be a beloved elementary principal in the Utica City School District. So it's just been just a tragic case. But I have three proposals. One of them is to, and again, nice job by Broome County. One of them is to model exactly what she said. We do have a DVHRT in Oneida County, a high-risk assessment team. But one of my proposals is to mandate and fund DVHRTs in the 62 counties in New York State. My second proposal, and they're all linked together, is obviously to mandate law enforcement to do lethality assessments on each domestic. And then thirdly, those domestics that meet the criteria, once the lethality assessment reaches the criteria. In our case, it's an 11-question lethality assessment. If they score 7 or higher, they get referred to the DVHRT team that we have in Oneida County. So again, my third proposal obviously is to mandate that those DIRs that meet that criteria be referred to the DVHRT. With 514 police departments in the state, I don't know what the funding looks like, because I know that's the question you're going to ask for me. We in Oneida County, our DVHRT team began again out of tragedy, a homicide in 2009. The victim's family was on a mission to make sure that to protect people in the future and to hold offenders accountable. So they went on a mission. They formed a foundation. They raised funds. They reached out to me. I took office as sheriff in 2014. They reached out to me shortly after that. And a few years later, about 5 years later, we officially launched our DVHRT. Our training was done through the Geiger Center. The funding was all paid for mainly by this non-for-profit from the family whose loved one was murdered, along with a state grant from our state senator, Joseph Griffin. So from that point forward, our DVHRT in Oneida County, the law enforcement members that are part of that, we don't have all our agencies. That's where I think maybe in my new role, part of MPTC coming up, I'll be able to help craft a way that we can mandate that all agencies become part of the DVHRT team. We have many of them in Oneida County, but certainly not all of them for various reasons. So we don't get a true picture of what's happening. So I think that's critical, that my colleagues are probably going to be a little frustrated with me because we don't like to be mandated to do anything, like most people. But again, I think it's critical. My mission when it comes to domestic violence, and I know the folks that I work with here are familiar with my story. My wife, before we met, was a victim of domestic violence, and she put me on a mission when we started dating 35 years ago to do everything I can as a police officer to protect the victims of domestic violence. So I've done my best to do that. Very proud of our accomplishments. We have a lot more work to do.
Thank you, Rob, and always thank you for standing up and telling your story, and your wife's story. Rob is also a member of our fatality review team. It sounds like we're all taking Rob up on his service. So thank you very much. I know that, Oneida County, I come from Oneida County, has a long history in trying to do coordinated community response. Is there something that you can tell us about what works and what doesn't work in regards to coordinated community response? Because it seems to ebb and flow. I guess the mandate would fix that, but
Yes.
is there something that you can see that has worked in Oneida County and that maybe we could learn?
Well, we certainly have our success stories. I refer to the Utica Police Department a lot because we have such a strong working relationship. Actually, they have a member of their DD person is here in this room today, which is really neat to see. We work well together, but there's definitely a breakdown in different areas. I can't pinpoint one specific thing. Like I said, on the law enforcement side of things, I think we have to do a lot more work to make sure that everyone is, I hate to use the word mandate, but unless they're mandated to do these lethality assessments and have that DVHRT. In our case, ours is run out of the YWCA of the Mohawk Valley. And again, we have some work to do there. We've been meeting with them regularly, trying to improve things. It's just hard to get all the players at the table because our team, you know, when everyone is present, we're talking law enforcement, district attorney's office, parole, probation, mental health, child protective, any other agencies that may be involved in that specific case that we're going to talk about. But to get those people together on a regular basis is sometimes very difficult to do, and that gets frustrating, you know, for me. I get it. We're all understaffed. I mean, I'm running an agency with 82 vacancies in the sheriff's office that I oversee out of 540 employees. So we struggle a lot, but we still have to do our job. And I just think, I don't know the answer. I don't know how we get everybody to the table in a consistent pattern.
Thank you again. Thanks for the partnership and everything. You've been outstanding, and we look forward to you becoming the chair of the MPTC in 3 weeks. My question is more so, you know, one, I think you're really pleasantly surprised. The governor included in the budget a lot of resources, and we're working closely with OPTV now to kind of get that those strategies out to the field. So I don't want to scoop any announcements, but
That would be bad.
that would be bad. We wouldn't do that. But I think you'd be pleasantly surprised with the approach that we're taking. And I think it is, you know, I'm also leery of mandates because to me, I think the state is at its best when it's a co-pilot, it's a partnership. And so I would love your thoughts on kind of building that capacity, the awareness of the models, high-risk teams, lethality assessments, which haven't been on everyone's radar, and particularly the more rural counties that you get to, you know, just getting up to speed on more of the evidence-based policing practices as a start, I think is a challenge. So, you know, maybe just any thoughts or comments on how do we build capacity and then think about the mandates that come afterward.
Well, I do know that one effective tool that we've been able to use is, I mean, we need to get buy-in from people before we force something on them. And I've sat in front of many victims, listen to them testify, and that is such an effective way to convince folks that they need to do something about this problem. And I know that works with police officers too. We were fortunate enough to have a victim who was willing to speak at a recent event that we held, and you could have heard a pin drop in that room. And everybody walked out and said, "Yeah, we have a problem here. We have to do something to fix it." Other than that, I don't know.
That's helpful. Thank you.
Thank you.
Thank you.
Thank
Ron.
you very much.
Thank you for everything. Thank you.
Hi, everybody. So I'm Megan DeShazaview, coming from Rochester, with the Willows Domestic Violence Center. What everybody else already said, so there's some amazing ideas that have come forward. That's all I got. So, I
Thanks
have
for coming.
There's possibilities for lunch.
So possibilities are great. So, did you get the
Spicy
pesto?
tomato oil?
Oh,
Nicole got the pesto.
The pesto is so good.
Okay.
That was my minute. I'll get my minute back.
I'm just gonna talk. Thank you. I wanted to start by recognizing some big wins at the state and then also share some of the pressure points that we're experiencing. Talk about the coordinated community response and some of the FJC type work, the collaborations in Broome County. We're doing something pretty similar in Rochester. We just launched an FJC pilot program last October, so we're nearly a year in. We know this from a survivor perspective, like the flow of services, they don't actually care what program we're providing services from, where the funding comes from, which agency, you know, I have on my name tag, they just need to have their needs met. And so we're doing this really critical work in partnership with all of our, with all the stakeholders. There's really a lot of folks around this table that really matter, and they're all there because they want to be there. So I want to talk more about that kind of mandate and what needs to happen to people, about the buy-in from people. So we have the high-risk team developing, we have co-location of services, we have been, the DBSJA was a huge win and has been applied in Monroe County so often. It's incredible to see what a massive win that is. DIRs are now being reviewed by the DA and the Sheriff's Office, so they're pulling all of them, looking at them together and deciding who they want to follow up with. Law enforcement wants to use the DAL, that 11 question thing, but it hasn't been a mandate in Monroe County yet, so they're asking for it to be a mandate, so the officers can be trained and utilize this. they need the directive and the training for the people who are responding on the street. This was launched with ARPA money, so it was a $1.5 million grant to Willow from the county from ARPA funds, which will of course dry up soon. And so looking to scale that up, I don't know, 10 million, Joe, whatever we want to.
Do that math.
Figure it out for us. And that would need to be shared by the partners, so an investment in all the agencies that are at the table, and then that of course brings the buy-in that we might not need to mandate if we have some money behind it. So that model, it is removing barriers, it is saving lives. We're doing it once a week and already we're seeing this huge impact, but it requires systems to work together in ways they haven't before and don't necessarily have the tools, which means, the courts, law enforcement, services, DV services, counseling, healthcare, the same kits, all the things we've been talking about that require authentic and engaged partnership at the local level that is mirrored and supported and at the state level. So we need you all to champion it for us, and with our respective partners, we at Willow, we are OCFS licensed, we are HHAP approved, we are DCGS partnered, we are OVS funded, we are in the world with all of you, right? But for our partners to also have OCA as part of this and to have the different agencies that they work with most closely championing this work at the local level would be really critical. Another huge win for us has been the flexible funding. It is literally saving lives. It's working. It's wonderful. This was an incredible investment by the state to be able to continue the flexible funding. We've been using this from both private and public dollars for a number of years. I just can't tell you how it just slashes through barriers for people that you are able to have the money in hand to pay for that next step along your journey. So oftentimes, for a long time, social services, we have been doing financial literacy training for folks, and here's how you budget the $2 that you have, right? We all know this. And so instead of saying, here's a lesson for you, here's some cash for you to be able to do what you need the most right now, and that has been literally saving. So I have a laundry list, and I have two big things I want to talk about. So the emergency shelter, we haven't talked about that too much, but the bed night billing. I just want to share that every day at Willow, like today, we have a 49-bed emergency shelter plus hotel programs, about 20 units that we fill every night. We have Kim, Joy, Toy, Tiffany, Suzanne, Chris, Kelly, and sometimes are all involved in the bed night billing book. A lot of fun. Goes back and forth via email, encrypted emails to Monroe County, where Teresa, Jennifer, Denise, and sometimes Thalia are checking boxes on their end and combing through pages of information and spreadsheets of our census to know who's in the shelter. Are they really eligible for services? Were they in their bed at 11 p.m.? Have they looked at enough apartments? Do they have a strong service plan? And I think sometimes our team is spending more time emailing the county back to us, than we are supporting the survivor writing for us. And so the inefficiencies of the shelter funding model, I could talk all day about this. I know I got the notice here. But also the risk of the confidentiality breach, navigating the daily reporting on survivor activity. All this information is going back and forth, and it's just gross inefficiencies of the system, and it has us all kind of spinning in circles. And then we have denials, and then we have open beds were not paid for children who may leave the shelter to go stay with grandma, or the kids go for a custody order to stay with the offending parent, and then we lose money on those beds because we're going to hold those beds. We're not going to give them away to somebody else because the kid's coming back in 2 days. So that I feel like is a pretty simple policy fix to say, hey, let's keep these beds for the kids, and be able to reimburse the agency that's holding the beds for the kids at a cost to ourselves that we make up for. Great job with that. So the same is true for single folks who can't stay in the room with other people. My last point on the shelter funding is that the county awards our agency about $2 million a year. It's gone up from about 10 years ago, it was 1.3, now it's about $2 million. We have that award for the bed reimbursements and this email that goes back and forth to prove we're spending those dollars appropriately, but we end up getting that money every year. And if they just gave us $2 million and then had some auditing process, throughout the year that could make sure we're doing the right thing, have that level of trust and oversight, then we would be able to have so much time back that we're not spending emailing back and forth every day, all the time. We love our county partners, but I know they're tired of us, and sometimes they're a little tired of emails back and all the detail. So that's the shelter, and then one more point, and I swear I'm done. Do I get time back for the possibilities comment? So the VOCA fix, this is the other big one. Our OVS funding, it funds 6 shelter positions, 3 mobile advocates, and our lot of the non-res, some of the res programming that we do is really supported by these OBS dollars through the VOCA. And while we are so grateful to the state for the VOCA fix, that was amazing that it came through and we're able to continue providing these critical services, it's not sustainable. So thinking about a way that the state can pick up where VOCA is falling. And maybe VOCA will continue to be funded at the federal level, maybe things will change and we'll see more, flowing into that as a resource for all of us, but I don't think we can depend on that. And so having a strategy that's more long-term at the state level to keep those funds flowing for us at the local level where we're literally saving lives. So that's what I've got. And my laundry list of housing and all of the really important things: language access, equity, workforce training, court efficiencies, visitation, safe dwelling and prevention. Oh, and funding for pets. If I didn't talk about that, my team would not forgive me, so that's what I've got. Thank you so much for listening.
Thank you, and always thank you for your thoughtful comments. And we've been talking about funding model and all of those things for a number of years, so thank you once again for keeping the drumbeat going and keeping us thinking about how we need to think about that. I do want to talk about your FJC. It's up. Are you guys up? You're running and things are.
We have a pilot program, so we're 1 week with our 4 partners, about 9 partners on location with us. And we have survivors by appointment only right now coming in through the different referrals from different agencies.
And do you have MOUs amongst the
Yes.
partners?
Yes. Yeah. And we're looking for a healthcare partner to be on site with us too, so we're trying to be as, wrapped around as we can.
Can I just ask a question on the $2 million the county gives you? Is that county dollars or is what's the?
It's Title
That's a
20
Title
dollars.
20 and one TANF.
So are they saying that the billing requirement is a federal requirement? Essentially, if they're like passing, just saying you need to have this billing. Like, are there other counties that you know that it's just handled as a block grant? Or?
No, it's all Title 20 money.
And that's how it's.
And TANF. I think it's,
Yeah.
And it has to be
TANF.
administered that way. It has to like get into that level of detail on the billing.
I mean, they're looking at our spreadsheets at 10 PM on our couches, is what they're telling us, so I mean,
But-
it is.
But to your point, Grant,
What about that? Wouldn't that be cool?
I don't know.
It could solve a lot of inefficiencies.
It's none of our agencies, right? It's HDA.
well, yeah.
Yes, yeah.
Well, and Title $20 are attached to the person.
That's the issue.
Yeah.
There's a lot of issues. Yeah.
There's a lot of issues.
There's a lot of issues.
We'll just leave it at that, that's it, right? Yeah. Megan, great to meet you, so, yeah. no,
Congratulations.
Thank you, I'm happy to come and visit any programs that.
We would love to have you.
Happy to do that, so, I've been, so far this week, I've been in Comstock, Buffalo, Syracuse, and Albany.
You drove right by
So,
us.
happy to run around. Yeah, the VOCA fix, I have been in, I used to work closely with Chris Rose, who's the head of OVC, and so we communicate quite a bit. I think we're in a temporary good spot, because the governor did a great thing by giving us $100 million to make sure that nobody's losing money for the 3rd year of their contract, and we're not gonna have any reductions in money for the next, contract. That's gonna be, the solicitations coming out probably in January, just letting you all know. But I agree with you in terms of the long-term strategy, and I think it's gonna be some sort of state conversations and Fed conversations, because I know the Fed's looking at it too, so we're super on it and super wanna kind of keep that. That's important. So, thank you for that.
Okay, thank you very much. Thanks, everybody.
Good afternoon. Thank you very much for the opportunity. I am Fanny Villarreal, and I am the Executive Director of the YWCA here in Syracuse, New York. I have been in the not-for-profit world for the last 7 years in different roles, from case manager, bilingual social worker, community engagement director, Spanish, English, interpreter, and executive director. As the executive director of the Spanish Action League between 1995 and 2003, I have the privilege to create the domestic violence services, which include the development of the curriculum for domestic violence interpretation services, as well as the supportive housing services when night shift just started. Today, I empowering women and promote peace, justice, and freedom for all. We provide supported transitional and permanent housing to domestic violence survivors. Since I have been in the YWCA since January 2013, our New York State Supported Housing Preservation Program has now received an equitable increment on per unit cost like the ESHI, the Empire State Supported Housing, everybody calls it ESHI program. And so, for instance, the ESHI program receives per cost unit $25,000 compared with the night shift project that receives $2,900. So I don't have visuals, but for example, ESHI is this big and night shift is this big. So we are, at the maximum capacity to trying to figure out how to do that, how to come out of that situation. To our YWCA sisters affiliates and the state of New York has closed their programs in Mohawk Valley and Buffalo. Consequently, if we do not, meaning the YWCA in Syracuse, if we do not see a change, we will be forced to close as well. The YWCA of Syracuse and Onondaga County cannot afford this raise and the long-term effects of closing a supported housing program like ours, will reduce the valuable intervention of homeless women who are domestic violence survivors, while reducing affordable housing for this generation. I love my job. Everybody at the YWCA loves their job. We love to see our participants flourish, just like every single person here. But the one that we serve deserve better. We don't want to re-traumatize them then again with closing our programs. Please consider for continued safe and affordable housing along supported services. We're asking that the supported housing preservation program receive the same attention and funding as the Empire State Supported Housing Initiative, ESHI, at the same priority and at the same level. That's it. Everybody that knows me knows that I like to talk a lot. That's why I brought this and focus on what I need to do. Thank you.
I know you very well.
Yeah.
You did very well. Thank you.
Thank you.
I don't have any math.
Thank you, Pam.
Thank you. I appreciate it. Thank you.
Thank you so much.
Thank you.
I'm not gonna do that well. This is very intimidating because, I don't know if I can do 4 minutes, so get comfortable, I'm just joking. And no possibility, and no math.
No math.
So, my name's Don McPherson, and full disclosure, I'm working with OPDP on their work to engage boys and men. It's work that I've been engaged for about 30 years. Ironically, you mentioned that 30 years ago some of the policy was created. I've been in this work that long. A little bit of background that's relevant. 30 years ago, I retired from professional football, where I came from a field that was results-oriented and driven by excellence, and driven by people getting better, and we worked to get better. We didn't do prevention work. In sports, in the classroom, you don't work to not fail, you don't work to not lose, and you don't work to win by a point or pass by a point. You work for excellence in the discipline. And so I come from that field, and I want to mention that right off, because when I came to this work, I learned from a man named Jackson Katz about all forms of men's violence against women that crosses across all of your agencies. So, I've worked in child sexual abuse, I've worked with people with disabilities, I've worked in prisons, I go back 40 years from drug driving programs here in New York State, back in the early 80s. And in all those different sectors, what I learned from Jackson was that it was about men's violence against women. And if we're truly going to prevent what all of you deal with in your agencies, we truly have to start changing the way in which we engage boys and men. If there is a definition of insanity of doing the same thing over and over and expecting different results, I have evidence of it. 30 years of doing the work in which we have been asking men to prevent violence against women, we've been asking men to be supportive and be allies with women. We haven't been asking our boys and men to get better. The field has not been interested in how do we help our boys get better and be better people. And as a result, we've been very good at calling men toxic and identifying toxic masculinity. And as a result, we have not been pulling boys into a positive conversation that they can lean into. And by default, their thought leader, and I say they, young men, their thought leader are the likes of Andrew Tate. Their sex education is coming from pornography that is on everyone's phone in this room. And I say this with all due respect to the state and to our Department of Education, we have failed young men in that regard. We have not given them something to work towards. And there's plenty of empirical evidence now about the multitude of ways in which men are struggling in drug addiction and abuse and everything that you all are seeing. And we have not moved from prevention to promotion. From prevention work that we've been doing to the promotion of what do we truly want for our boys in families and relationships in all the different ways in which they operate and function in their lives. And so I talk about aspirational masculinity. It's the work that I'm doing with OEDB, convened a conference here in Syracuse a year ago on aspirational masculinity with the coalitions. And the goal is to reshape the conversation. By the way, I don't blame the women and the women's work, the women's movement for, I blame men. And I blame men in our field for Andrew Tate. Because we've been doing the work that women have asked us to do, we haven't been doing the work that our boys need. And there's plenty of empirical evidence about what's going on with boys and men. And so I am not here to ask for money. I'm here to implore that we change the narrative in how we engage with boys and men, that we make it more positive, because ultimately they end up in all of your agencies. And gender-based violence, and so far today has been directly around masculinity and what's going on with men and boys, who are overwhelmingly the perpetrators of all the issues that you all deal with. And if we are going to solve that problem, we have to reframe the ways in which we engage in boys and men and do it in a positive way. And I'll close with this. We have to believe, and I'll say this once again with respect to the field. I don't believe that our field believes that boys and men can evolve, that boys and men can change, which is why toxicity is such a powerful word. Toxic, before we used it to talk about masculinity or relationships, was most often used to talk about waste. You separate toxic waste from garbage. And this is a generation of young boys that have been told that their identity and their identity as being male is toxic. That's why Andrew Tate has become so appealing, because he's giving them something, as opposed to saying, remove all the qualities in which you've been raised to adhere. And we have to believe that boys and men can evolve. And I will be honest in saying I don't believe that our field has always believed that. We just want men to stop the violence and to protect and support women and girls. And I will close with this about the belief in change and going back to that excellence conversation. A lot of talk has been made over the last several weeks about this being the 50th anniversary of a woman being able to get a credit card without the signature of a man. And if we go back that far, 50 years, we go back to the 30 years at least that I've been doing this work. I've been involved in women's in sports and Title IX and women in STEM programs, and all the things that we've done deliberately and intentionally to help support women and girls. It was never about training women and girls to be something specific. It was about saying that they were empowered to be whole people and they could do anything. It was never anything specific. And as we speak, if I go back 50 years, as we speak, there is a woman named Jeanette Epps who is in space above us. And if we go back to when she was born, there was a very good likelihood that her mother could not own a credit card without the permission of a man. And we were deliberate and intentional. We didn't expect her to be an astronaut, but she did. And I say that as evidence that if we're deliberate and intentional with a group of people, they can change, they can evolve, they can be better, they can be, as I said at the very beginning, be excellent. That is and if you want to just like put a bow on this, and I was told by Kelly not to be political, but y'all all in love with this football coach, right? Last night you saw football players or guys in football uniform, right? If we can be inspired by that, not just about the football coach as the vice president, or the man, the white man, who is showing his wholeness by being subservient to a black woman, that evidence of where men can move. But more so, I know that I speak from a place of extraordinary privilege in this conversation. But I want to say this, and the last thing is that, isn't it so much better? Doesn't it feel so much better watching the convention with hope and joy and all the work that all of you do? Doesn't feel like hope and doesn't feel like joy. And so part of this aspirational masculinity conversation is one. I hope that these boys can be better, that they don't end up being part of the services that you all provide. Thank you.
Note to self, don't tell Don not to say something. So, Don, I just had, I know you're doing work with us, but I think maybe Joe might be interested, you might be interested in the work that you've done in law enforcement.
So, I actually heard about the teacher, the principal, from my colleague this morning. The work that I've done in law enforcement, I'm the son of a cop. I'm the son of a man who was a loving father and a great man, but a man who never came home and talked about himself. Never came home and talked about his work. And very often when we talk about what we expect of law enforcement, once again, we want to talk to them in the role that they've already sworn an oath to do, to protect and serve. They're already sworn an oath to do that, and yet when we talk to them, we want them to do a better job of that, specifically on our particular issue. And where law enforcement really needs the help, and we saw it here in Syracuse over the summer when two officers were murdered, and I don't know if there's a way to say it the most heinous way, but that law enforcement needs that support as well. And I know that there were so many things that I learned from working with the local police department here. I learned about my dad. My dad's been dead for 12 years, and I learned a lot about my dad just by talking to and trying to understand what's going on with law enforcement. We've been vilifying them here in this country for a few years, and with lots of arguments about the role of law enforcement and how law enforcement functions. But what we haven't been doing is welcoming them into this conversation as well. And it's a very important, and it's one that is going to support them. It's going to support law enforcement generally if they're seeing that they're coming into this as whole people. And so part of the work that I did with law enforcement was about really talking to men and women in law enforcement about themselves, and not just about what we want them to do for others.
Thank you, and I think a few things. One is, we use the word evolve to talk about boys and men, and I would use the word healed, right? So in some ways, the trauma-informed approach that we all kind of practice and we know about is always starting from a deficiency. What's your weakness? What's wrong with you? We don't want to do this. We want to prevent this.
Right.
Instead of starting from what's right with you.
Right.
What is your strength? What are you good at? What do you want to be? And I think some of the work by Sean Ginger on healing-centered engagement, I think is there. We have created among our systems a focus on response, and particularly in the justice system, we're always focused on, okay, now after you return to your society after being incarcerated, we want to help you form your identity, we want to help you stabilize, we want to help you learn how to do cognitive behavioral therapy, to think, change your thinking, change your attitudes, change your beliefs. But where is that work on the front end, right? And so we talked briefly about it, but I think it's worth sharing here. Just, there isn't one agency that owns young people before they get system.
Exactly.
We can talk about education, that's only in the classroom setting, but how do we do better as state agencies and as leaders within our community to focus on the boys and men and to create that aspirational masculinity that's that image. And when you were talking, one of the things that came to mind for me was, I'm the first person I ever went to college, I'm the son of divorced parents, and I didn't know a positive role model until I met my stepdad. Right? He was a paramedic here in the area, and I got so excited when my mom started dating Dave, and I was like, this is the guy. He's Marine, he's younger than my mom by a few years. Good for mom, But she robbed her cradle. But it created in me this clear dichotomy of somebody that I could aspire to be. And so I just, as you're talking, I think it's not only critical that we change our thinking, but that we reframe the way that state governments start to develop policy.
Yeah.
We do a very, very bad job about making policy for the family and making policy for young people who don't have a pension system yet. So I just want to uplift that, share my story, and also thank you for the work that you do.
Absolutely.
Yeah, sure.
Thanks, Tom, for your work. It's been a long time.
Yes.
Good to see you. I think, what it's more a reflection kind of on what you're saying is like, I think the other thing that we do is we criminalize young men, especially young men of color. And when I think about my new agency now, the Office of Victim Services, there's all this of needing to report to law enforcement, and so the law was changed recently. Fair access goes into effect in December of next year. Allows people to access services without going through law enforcement and having to report. So I think that's going to be helpful on one end. I think the other thing that we're really looking at is some of the policies and procedures that we have, and some of the underlying law that looks at treats people who've been involved in criminal justice and who've been through the system differently than people who have not. And so really looking at that impact, and if there's ways that we can change that too. Hopefully as a way for young people who are also disproportionately victims, for young men of color, that they can see that they can access services that I think we haven't been, it's been very hard for them to be able to access, so thank you for that.
And I will go back to not just young men of color, but to your point about how that this is trauma related. Bill Hook said the first act of violence that is asking males is not violence against women, it's violence against themselves. And that's white or black, it doesn't matter your background as a boy. And that trauma is what, and I'll ask law enforcement, if you heard there was an active shooter, who are you expecting with a gun?
I expect
Yes.
bad guy.
Do you know the identity, if you heard active shooter, do you generally think of the identity of who you're going to confront?
No.
No? Male or female?
You're putting him on the spot.
I know, I'm trying to.
Stop, it's not your show today.
We know, okay, so I will say this because again, Kelly, I'm gonna sit down. But we do know that overwhelmingly, the person who showed up in Buffalo at a grocery store was a white male. And we know that is, and I don't say that to disparage white men, I say it to say something is going on with white men. And we need to pay attention to that. And it's not just boys of color who, something is going on with white, and we need, and okay, so I'm gonna sit down.
We'll take it, we'll
Thank
take
you.
it.
Hello. My name's Justice Gator. I am a domestic violence victim advocate.
Great name.
Thank you. I'm a domestic violence victim advocate with Family Counseling Service of the Finger Lakes. So we cover Ontario and Wayne County for our DV services. We're a community-based nonprofit. So I submitted a couple of proposals, but I want to talk about, I'm going to focus on one, and then if I have time, I'll summarize the second one that I brought. So the first one is related to family court. We had someone talk about supervised visitation, and in the almost 4 years that I've been in my role, I can count on my one hand how many times I've seen supervised visitation granted when someone asks for it. It's very often not, and usually countered with, hey, how about mediation? So, with survivors in family court, they often say that they should have just stayed, that it's not worth it, and that's due to quite a few different factors. So there's an inadequacy in training and awareness among our family court judges. I'm gonna move this 'cause I can't my forehead. So there is a policy mandating judges to take trainings on domestic violence, but but there's a significant gap between this training and its practical application within court. Judges may fail to fully comprehend the impact of DV on children, especially the abuse isn't directed directly at the child. And that misjudgment can often lead to undermining of protective measures, and I think I just read in a study that I cite in one of my other proposals that when parental alienation is used as a defense in family court, it almost doubles the risk of mothers losing custody to that offending parent. And it decreases the credibility that judges see them having significantly. So because of all of this, and because of joint custody being the norm, I can also count on one hand how many times it hasn't been joint custody, and it has been sole custody. But to address this issue, I propose implementing a policy that introduces domestic violence professionals within the family court system. New Mexico implemented a policy in 2005 where they created a domestic violence special commissioner. And that commissioner oversees orders of protection requests. They're also a licensed attorney. I think that New York State could enhance that model and expand it by establishing a domestic violence advisory team in each family court. And I think that that's important, that it's not just one individual, although I do think that one of the individuals at least should be an attorney. I also think it should involve at least one domestic violence victim advocate, so that it would ensure that both legal and survivor-focused perspectives are integrated into the handling of DV cases. We would need to implement a screening process, and I'll skip over some of these because you can read them and I don't want to run out of time. But essentially, if this team could meet with judges reoccurring every week and talk about these cases and provide recommendations, it adds an additional layer of accountability to judges, because right now we have a peer-led model that's not efficient. And these professionals could provide recommendations to judges and educate them further and improve the outcomes of survivors and their children, and hopefully breaking that cycle and not exposing the children to more abuse. We know that post-separation abuse is real and it's very prominent. And family court focuses solely on the child, which is great, but it also prevents them from seeing a bigger picture, that even when the abuse is directed towards a non-offending parent, that affects their parenting abilities. So that's it for that one. How much time do I have? So the next one that I wanted to talk about is, I was sitting in criminal court on behalf of a client one day, and I was seeing a lot of DWI cases and how they're handled, and how there's a lot of accountability that's put in place for offenders for DWIs. And I thought, when someone is charged with an offense related to DV, you might get an ACD for a year, or you, if you're lucky, might get probation. Other than that, there's really nothing there. So it led me to think more about the victim impact panels that are done for DWIs. And I did some research, and it turns out that there are several jurisdictions across the U.S. that have survivor impact panels for domestic violence offenders. Even Texas has one. So they, survivors, the short-term results for this, there's not a lot of long-term research because they're so new, but for short-term research, the survivors report that they experience healing, empowerment, and validation, and offenders exhibit increased accountability and a commitment to change. So my proposal for this would be for the creation of survivor impact panels, and having probation
one of those, everything old is new again. You know, it's bringing back those things that we all did, and then the funding went away, and they went away, when we were all, I'm old, you're not, so,
I feel it.
yeah. That I'm old, or no?
No, thank you for your comprehensive proposals. I think my question was around that survivor impact panel. So the models that you looked at, or are they all kind of locally created, or is like the state, is any of these instances kind of supporting the development and implementation of them?
So I didn't get that far into it, but from what I could tell, it looks like they're locally created. A lot of times offenders have to pay a fee to attend. I saw some fees as high as $100. The one thing I didn't see that I think should be included is compensation for survivors for their time and their energy in sharing their experience, which is part of why I think the need for additional funding would be there.
And likely also, having a counselor there, so in case it is re-traumatizing, right? And so being able to deal with the secondary.
Yeah, and part of the panel with a DV advocate there as well is debriefing with the survivors after that panel. So having a counselor there for that would be awesome.
Thank you very much for the ideas.
And I think some of those survivor panels are also connected with long-term accountability programming.
Yes, they are, yeah.
One more, Joan. Save the best for last, Joan.
Oh, wow.
That's not the pressure. Wow, thank you. Hey, everyone. Joan Gerhardt, Director of Public Policy and Advocacy, the New York State Coalition Against Domestic Violence. Thank you for having me. My comments today, the proposals that we offered to all of you are based on a couple of listening sessions that we had back in July. We've talked to our legislative committee. We've had lots of one-on-one conversations with advocates around the state. What I really wanted to elevate today of all of the proposals, something we haven't yet talked about, which is contracting. So this is a significant challenge facing DV programs right now. The state's contracting has been delayed for months. It hampers everyone's ability to operate. It hampers their ability to pay staff. DV programs are really in a financial crisis. I mean, I am not exaggerating this. They are spending every moment trying to figure out how to pay their staff, how to keep their doors open. So we've heard wonderful ideas today, really wonderful ideas. We need to focus on keeping those victim service programs alive and well. Everyone's focus has to be there right now. State agencies are rarely complying with the contracting provisions in Article 11B of the state finance law. According to the state controller, more than 5,000 contracts the state entered into with nonprofits last year were processed after their start or renewal dates. That's 56% of the contracts that the state entered into. Notably, all of your agencies, OVS, OCFS, OTDA, TCJS, and OPDD, each reported having at least 92% of your contracts hit. That's according to the controller's report. So think of the cumulative impact of that. When the agencies responsible for distributing the majority of your funding are all late. So that compounds the impacts on their bottom line. Obviously, when the contract approvals are delayed, nonprofits can't voucher for reimbursement. They have to dip into reserves, lines of credit, obtain interest-bearing loans to pay staff and keep doors open. In just the last week, 4 programs have reached out to NISCADIV with dire circumstances, not being able to meet their staff, to pay their staff this week because of late payments. Payments, DCJS, have been late since October. 2 programs can't voucher, one on a $100,000 contract, another on a $165,000 contract. Now, I'm not here to point fingers at any particular agency, I'm really not, but to raise the issue. This is a really big issue facing programs, and it's not just DV programs, it's nonprofits. And I think it also involves not just the state agencies, but certainly Division of Budget and the Controller's Office. DV programs for the last 10 months have been told, be patient, wait it out, we're working on it. 2 to 3 months delay, but 10 months delay, I mean, you just can't manage that. State law has protections for nonprofits in the event that state partners are late approving contracts. These protections include advance payments, loans, interest payments. I'm not aware of any DB program that's ever gotten an advance, certainly not in this last 10 months. No interest payments, no non-interest bearing loans. So this is really a problem. We've recommended a number of changes to the state finance law to help ameliorate these issues. Require fully executed contracts 30 days before the start of a contract period. Require funding to be available at the initiation of the contract. If the state is late, require the state to provide a 30% advance to existing grantees on the first day of the contract term, and then require additional advances each subsequent quarter. Reestablish a monthly drawdown, we've been talking about that for a while, rather than a vouchering program. And create an ombudsman who grantees may contact outside of the state agencies who we typically contract with to elevate issues related to delays, non-payment, or really any other issues on contracts. So the other thing I wanted to talk about related to contracting is on procurements. So we know that next year, 3 agencies are going to be doing pretty hefty procurements. We have OCFS, OBS, and DCJS. We've asked the state about consolidating some aspects, if not an entire application, but some aspect of those applications. Programs are spending an inordinate amount of time on paperwork. We know it's coming. We know this is coming. And we're just asking the state to please consider consolidation. When we raise this with all of the state agencies, we've gotten some like, oh, that could be great. We know the state, OPDB, worked on this a few years ago. Unfortunately, that didn't really resolve the issue, and we're just appealing to the state agencies. There's still time before those procurements are issued. Please consider consolidating at least some aspects of your applications. We heard a little bit today about the funding, particularly shelter. Yes, we've been engaged for quite a long time in a conversation about some fix or modification upgrade to our per diem reimbursement model. We think that's great. I mean, back in 2020, following the recommendations of the DD task force, many of us participated on that. Funding was earmarked in the budget to pilot an innovative survivor-centered DD funding model that reduces barriers and challenges to getting money to programs. The intention was to identify a comprehensive, flexible funding model to support the continuum of care for survivors, right? Not just in shelter, but that continuum of care. Each year, that authorization for OCFS is still in the state budget, and we really want that pilot to start. So Trish, maybe we can work together to get that pilot off the ground, because we think it's really, really critical to really start to examine. It's not just a payment issue. I mean, that's obviously a big issue. We're spending a lot of time chasing down payments. Programs like Willow said, Nika said, was just signing paperwork, emails back and forth to the county, the DSS. There's got to be an easier way to get out getting funding to our DV residential programs. And one of the proposals that we provided to you was to remove DSS from that conversation entirely, and maybe have it be direct funding from OCFS in a grant or some other payment agreement that covers what we pretty much know is the average spent on reimbursement services every year. So the one thing I wanted to leave you with, and I'm wrapping up, is an issue that I know we've all been hearing about, talking about, which is the safety of children in family court. Here in Syracuse, you probably heard the devastating murder of a 4-year-old boy in May. That was Rayburn Brown, and he joins Kira Franchetti, kids who have been murdered by a parent during child custody proceedings since 2016. It's just got to stop. It's got to stop. Here has
the most compassionate governor I think we've ever had. Governor Hochul really truly understands domestic violence, the dynamics of domestic violence, and she understands the experiences of survivors and their family members. We urge her to include Kira's Law in her executive budget in January. There's too much hand-wringing about this, but the need is clear. We need to prioritize children's safety and family life. And Kira's Law does that. It includes the judicial training that we've heard about from others today. And it ensures that orders of custody and visitation really include protective measures to make sure children are safe. So with that, I'll close. Thank you.
Thanks. It's good to see you mounted at Zoom box. I feel like I only ever see.
Am I shorter?
I wasn't gonna say that. No, the state's hard to do business with, and for that, I apologize. We are taking measures to do better, but also at the same point in time, I feel like it is one step forward, two steps back. The calls for patients really came from our being pushed into the SFS void. For a long time, DCJS was able to use our home build system, the grants management, grants gateway, and our grants management system, and then they finally figured us out. So our team has kind of been trying to learn the SFS system at the same time that we're moving grantees into it, which is a nice good thing that we've been building the plane as we fly it. And again, I'm sorry for that, but feel free to highlight the concerns. I know that you've reached out, I think, to OBDB, and we've flagged a few of those, but knock on my door. We will go to the comptroller's office. We have had a few.
So he'll put your name in the building so you can get in.
Yes. You get in, you won't be able to go to the 11th floor, but you can get the 8th floor. And because we do want to, we take seriously our obligation to fund community-based providers and make sure these services are provided. We're not a one-stop shop. We can't fix the comptroller's office and DOB and all the other things, but for the parts that are in control, we want to do better. And I'll just say, from my perspective, I mean, community-based organizations are the fourth branch of government. If you look at the trends of all industrial democracies, they've all decided to push social services to community-based organizations, and then they've divested from many of them over the years. And so I think it is our job and it's our responsibility as enlightened public administrators to restore that faith and confidence in government, and that starts with us meeting our obligations to you all who represent the field. So with that, I'm here to be helpful, and for my part, I really appreciate the time, effort, and energy to reach out and build partnerships. Thank you.
Thank you for saying so. And I do want to point out too that sometimes there's a reluctance, for a grantee to elevate issues, and so I think it's great that we're able to communicate and maybe assert a role, but you might be hearing from more people if there wasn't that concern. I mean, we know there wouldn't be a repercussion.
Yeah.
But that's always a
No,
question.
it's in the same way that we want to build trust and relationships that promote safety and cooperation in the field. That's the whole work of DCJS and many of our agencies. We have to do that for ourselves as well, and so that trust has to go both ways. And I love the idea of an ombudsman, but it always adds another cook to the kitchen. And so I'd rather be the one who just gets the phone call and says, hey, let's figure out what's going on here. Can we be more transparent? Have we knocked on all the doors? And that's the offer that I have to you and to any of the providers that have DCJS contracts. We don't always get it right, and in many ways we're always playing catch up just based on when the state fiscal year wraps. And so as you were talking, I was like, we need such an ideal world to live in, and yet can we as government get there? And if we can't get there, then how can we make life more sustainable so that we're not so far behind and that organizations can't make payroll? That's where we should draw the line.
Yeah, and that's just the current crisis. I mean, I think this issue with contracting has been going on since the prompt contracting law was put in. When was that? Years ago.
Thanks, John. No, I appreciate it, and it's good to see you. Yeah, I mean, the same for us with what Joe was saying. I think my first part of my career was all working in nonprofits, so I totally get the dance and how frustrating it all is. And so, that's something that's been very super important to me is moving what we can as quickly as we can. And there's so many layers of bureaucracy that are just like sometimes unfathomable. So I'm trying to learn those in the state now. But yeah, I mean, my understanding from, at least from OBS and from I've had conversations with staff tracking and speed of things, and my understanding, and correct me if I'm wrong, is that there were definite glitches with the new STS system, and I think there's some confidence with staff that we think things will be moving forward more quickly, but if you're hearing otherwise, please, reach out to me, because I'd love to hear about that and figure out how we can, if there's ways that we can try to fix stuff, I'd like to do that. And then I read a little bit about the consolidation, and I have a million questions, and so I will definitely talk to my colleagues here about this. I guess my one question to you is, like, do you have examples from other states that have been able to consolidate things?
Yeah.
Okay.
Yeah.
Okay.
And what I'm hearing too is even if it can't be, we know all the federal funding has different requirements.
Yeah.
But even if it's just how you're asking DV programs to describe themselves, their geographic region, the services they provide. One application will say, describe your geographic region in 20 words. And another application will say, do it in 250 words. That's like a very different, so you're doing it 8 different ways when it's really just the same information. Even something as simple as that, just give the same space, so you can cut and paste across them.
Yeah, so we did pilot the consolidated funding application process in before you were there, clearly. Yours and ours went through that process. We have been in conversations with Chamber, because it was a Chamber-led initiative, to see if going into the next iteration of all of our funding, are we gonna be using that? I think your information will be helpful in informing that decision, so happy to continue to have more conversations about that and what that should look like and how we move forward, or how do we move forward, and also what's the next step, right? What are we doing all together to think about that funding going forward? When we know that BOFA is in the situation it's in, that was in the situation it's in, and how do we really figure out how to stabilize the system, right? Because I think for years, we have treated each individual program as each individual program and not part of the system. And I think that's the discussion that we'd like to continue to have between one another as well with the coalitions.
Great, thank you.
Yeah, and with just the caveat too for OBS that, and this is not just domestic violence, that we include all crime victims, and
Yes.
so just throwing that out there.
Right, that's what I mean, like I know it's different
Yeah,
audiences.
yeah.
And, right,
Yeah, so just wanted to.
thank you. Yeah, great.
We're good? Thank you. I'll give everybody a few minutes to close up. Joe wants to do more math. He's doing that DCJS math.
Yeah, we're gonna need a bigger vote. No, I would just say thank you to everybody who provided testimony, both written and verbally. I think it's critically important that these state agencies do this, which is to convene, facilitate, and support our local partners, right? I said it at the beginning, but to me, state agencies are best when we are a co-pilot to the work that's being done in the community and in the state, the local agencies. And so thank you to OPDV for convening, and I hope this was helpful to you all. I want you to know that from DCS's perspective, we are taking it back in real time and incorporating it into the work that we want to do, not only for the next year, but also for this year. So thank you, and I'm happy to provide my contact info to anybody.
Ditto. No, but I just really wanted to thank all of you for coming and speaking. It was really powerful and informative. Definitely going to be taking all of this information back and figuring out what we can do at OCFS to better, collaborate together with our state agencies and with all of you and improve the practice. I'm excited to bring this information back, so thank you.
Same for me. I just want to thank you all for taking the time to come out here, because I know you all have very, very busy jobs and lives, so thank you for doing that. And, in addition to what Joe was saying, I think, too is then also the collaboration on the state level. So in addition to the work with you all that I think I want to commit to collaborating with my partners here too, because that's really critical for the work. So thank you for that. And
Pass it to you.
Ditto.
And thanks Kelly.
Oh.
At OPDB.
Well, yeah, and I'm a pain in the butt, but that's okay. You love me for it, don't you?
You use emojis.
I do, I put a smiley emoji. So I want to thank all of you. You know, your voices are critically important. And as he said, you know, sometimes the voices that we hear aren't necessarily the voices of the survivors because they don't have a voice, and you give that to them. But it is our intention to center the voices and to center survivors and to make sure that the system that works in gender-based violence is survivor-centered, trauma-informed, and culturally responsive. And we know that our state partners are committed to that as well as the governor. We have an incredible opportunity with this governor to make change within the system. And when I say system, as you can see, there's all of us, but we also talked about disability work. We've also talked about all of the other systems that interact with a victim or survivor of gender-based violence. So I appreciate your partnership. I appreciate you coming and putting things on the record, because so many times we hear a lot of things and we try to make sure that voice gets up to where it needs to go. But your testimony here today makes sure that it's on the record and that you have been heard. So I want to thank all of you for your time, effort, and the work that you do every day. So thanks so much.
And thank you, Clark. Great job.
Hey, I wanted to introduce myself and just say, I think we may have been in a Zoom together at some point, but we've worked with your folks before. When you're talking about the family court program, if we have something like that, so I'd love to invite you guys over to like see the space and learn about it. So we've been doing since '94. We have like a separate secure waiting area, family court floor, third floor, and then we have 4 or 5 ER advocates on site, plus a couple of legal aid attorneys. And we meet with the clients before and after they appear before the court. So does your staff meet with the judges and like talk, not weekly like you were talking about? That would be like life changing.